It's costing about $1.5 million per day to the swine industry, and that is a very important number. It's probably the most important economical disease for the swine industry, and I think that's why we have changed our thinking and going into area regional control. Also, I guess you guys have also been hit, and you have probably heard about this new variants, these new isolates coming up. The latest one is the one that showed up in Missouri. Is that working? Oh, okay. So where systems that have been negative or naive for many years got hit, and you can see the numbers, you know, all this technology. Okay, there we go. So we can see the great impact that it had. And you can all also imagine the moral effect it had on people that have been negative for a long time, that had really not dealt with PRRS virus, and they have to deal with it. So that's some of the reasons why we have decided, and what I think the whole swine industry is proposing, to go to area regional control. So we have this rule about transmit unto your neighbor as you would your neighbor transmit upon you. And I think that with Scott's research about aerosol transmission, this is really important. I don't think that that's the only way PRRS virus is being transmitted today, but I think it is really important that we take into consideration that aerosol transmission plays a very, very important role in lateral introductions, either to positive or to naive farms. So that's very important in our concept. So, what is our definition of area regional control? For us, it's people working together, and you can call them neighborhoods, you can call them clusters, it really doesn't matter. It's just working in your own area with your neighborhoods. And the idea of area regional control is to achieve better results than what you would achieve if you would be working on your own. Because I know that a lot of you have PRRS virus under control. Some of you might have thought or have gone through elimination, but sooner or later we have problems from lateral introductions and we get contaminated again. So the idea today is to go and control the area. I don't think we're talking about elimination today. I think we're only talking about control. Elimination, I think, will be in the future. Elimination might be an option in geographically areas where they're really away from densely populated areas. That is a fact, and there are some projects that are leading first to control, but their ultimate goal would be elimination. But other projects are saying we would be very happy with control. So it depends on the area where you're at and what your goals are. And I think that is very important. I think that from the beginning, it has to be established, where do we want to go, how are we going to do it, and how long each one of the different phases is going to take. Because that will give everybody a plan to follow and to know if advances are being done or not. So, as I said, elimination for us is where it makes sense due to geographical location, etc. But more and more we see that people are really thinking of control. First of all, of course, we want to reduce the economical impact that we already talked about. But the second, and which is also important for us, is to reduce the load or the genetic diversity that we have, because we know that there are a lot of different isolates. And at the end of the talk, I'll tell you a little bit about some projects that we're working with all these different area regional control projects in trying to understand the importance of load and genetic diversity in the different production areas. To tell you the truth, we don't think there's a template or a recipe of how to do it. And if any of you would like to visit afterwards with me in detail about the different projects going around in the US, because I don't have time to explain them all, you would find out that they are all very different. They have all started very differently, and they are all managed differently. We are trying to get a standard way to do it, but they are very different. So there's no recipe. And I think that the biggest thing for, particularly at least for me, I feel very honored, is that we are invited to support all these projects who are learning a lot. Every single day we learn one more thing about PRRS virus, how can we control it, and every single group has a lot to do. And this is a good time to tell you that we had a workshop in Pork Expo. So if you are interested in listening into detail, there in Swinecast, all the different presentations, the different groups presented, and there you can get a perfect idea of what's going on around the United States and also in Canada, because Ontario has just started a new initiative for area regional control of PRRS virus. May I ask who's taking my time? Can you tell me if I'm doing okay? Okay, so this is as a BI, as our area solution team. Our area solution team is a group that is supporting the swine industry in the different initiatives. So this is what we are proposing as, I don't think this is working well. So this is what we are proposing. We have divided the United States in two regions, Eastern and Western, and it might not be the perfect division, but I am in charge of supporting the Eastern United States, and Jean-Paul Cano, my colleague, is in charge of supporting the projects and initiatives in the Western United States. This is a pretty busy slide, but what I would like to tell you is we're called the Area Solution Team, whatever that means, but what we are doing is supporting in different initiatives, like if people would like us to help them in mapping, if they would like us to help them in, I'll show you the different tools that we're using, that's what we are doing. And we have also a group of different consultants in the United States that gives us feedback on how things are going and where they think we should go. We are trying, Jeff Zimmerman's initiative on oral fluids is really incredible. I think you're going to have a great talk, and I think that this tool that Jeff and his group have developed is going to have a big impact on how we monitor right now the success of these different projects. I'm sorry, in the Eastern United States, Enrique Mondaca is supporting me. Enrique has a lot of other responsibilities, but he also supports me on different things, and JP is supported by Dale Paulson. What we are proposing, when we started getting invited to all these different groups, we found out that there was really no order or method. So what we did, this is a white paper, and it will soon be available to anybody that would like it. And what we did is, in this paper you will find these 5 proposed phases, and there's about 25 different appendices. And then you'll find out basically everything that's going around. If you want to know who's funding ARC, you go to that appendix, and then you'll find out in the United States who's funding. If you want to find out diagnostic tools, then you give a click and you'll get exposure to all the different diagnostic techniques, what laboratory is giving them. If you want to find out what is the different strategies to control PRRS virus, there's an appendix for that. So that's what we're doing, and hopefully in the future, we want to publish it so that it's still not publicly available, but in the future we will. But if you need to find out certain things, if you're interested in knowing more detail, we can at least share them with you. So we're proposing 5 different phases, and I think this is one of the most important phases. This is the feasibility, and I can tell you this is to determine if the project will be successful or no. And I can tell you that most of the projects did not go through this phase. Most of the projects started as goodwill, we're really tired of PRRS virus, of the economical impact. And that is good, but it has also set some setbacks, because sometimes people start thinking about these things when they're already in phase 2 and 3, and they have to back up a little bit. So these are the key things. We think that it is very important that producers and veterinarians work together. Most of the projects have been veterinary initiative. It has not been the producers' initiative. But we think, of course, they are the owners of the pigs. They should really buy in our program. But I think we really need to explain our producers what are our goals, what are the expectations, and of course, what is the cost? Because there will be a cost. I think that going from phase 1 to 3, you'll see that there's not that much cost. But when you implement your herd plans, when you start monitoring, there is a very important cost in these programs. But of course, we have to make an ROI analysis, and we are sure that the return will be very, very significant compared to the investment that we're doing. Another thing that's very important is information sharing. So it has to be very clear how information is going to be shared, who's going to have access to the information. For example, who's going to be able to look at all the sequences? How are we going to handle all the different information in sequences, etc., all these different things. So all these things have to be very clear since the beginning of the project. The second phase is pretty straightforward. Today we have so many tools that it's very easy to get all the characterization of the area. Right now with Google Earth, and there's a project that is called ArcView, can map you anything, anything you want, you can do it. I'll give you an example. There's a project in Illinois led by Bethany Health Services, and that's the DeKalb County. And what we did, they told us more or less, Enrique Mondaca, who is really good at mapping, he went with Google, got all the buildings, we had a meeting, we produced a big map, we had a meeting, all the producers came in and made sure that all the sites, it's not just the barns, but you also need the feed mills, the buying stations, slaughter plants, truck washers, everything needs to be there, because that will give you the information of how the project will be handled. For example, in Pennsylvania, we have an area on the northern part that is going through elimination because it's very well isolated. Most of the farms there are already negative. So that part of the state really is aiming for elimination. The rest of the state is just going through control. But when you have the map, that gives people, expert people, the idea of can we do it all? Should we divide it in different areas, etc. So that's what we're doing with all these different tools, which as I said, is all this different information. PRRS status, most of everybody knows their own PRRS status. So it's very easy to punch it into the equation and find out what's going on. We can produce very anonymous maps if you would like to, because some people don't like to see, this is my farm and this. So we can do. As you can see, this is a map where you don't know where the farms are, but you know how many farms there are, how big they are, how many PRRS outbreaks they have had in the last years. So you can have all information, and if you don't want to disclose the exact name, you can do that. I can tell you that that's how it started, but I think that as we've been moving forward, people are really wanting to know and understand the information. So more and more, these are the type of maps that are being produced, where everything is there and we understand. Because we need to understand the impact of roads, of mountains, of different barriers. It's really, really important. So here, what we were asked is also something that's important with this aerosol transmission, to make buffers of different areas to see, how many farms are in a mile, in 3 miles, in a 5-mile radius, to better understand what is going on. So that would be phase 2. Then we go through phase 3, which is where you have to establish all the different flows, the prevalence, everything. So internal, external movements, and this is a part where we run the PADRAP. So I'm not sure if all of you are familiarized with PADRAP, but there was a tool that was developed by BI, and then it was given as a gift to the American Association of Swine Veterinarians, and it's run today by Iowa State University. And what it does is gives you an analysis, a risk analysis, both internal and external, of your risk of getting contaminated with PRRS virus. The tool was developed to be used just farm by farm, but we have found out that right now this tool can also be used in a regional. So you make all these questionnaires, all the surveys, and then we are getting all that information, and we come back and say, in this area, the most important risk factors are these ones. These are the ones you have to work as a region, not only as your own farm. So you have the two options. And it is really interesting to do this, to work with the PADRAP system. So, and we are using right now, there's a paper that will be published very soon with a group that got together and categorized farms, because sometimes people talk about negative, other people talk about naive, other people talk about positive, shedding, excreting. So there now is a categorization of farms, which is very important to understand. I know where my farm is today. I'm going to implement these changes. Where is my farm going? And now we'll all be talking the same language. So that is, okay. So this is the PADRAPs, and as I told you, it's really interesting what we think we're doing And what we are really doing when we come back with all these results, people say, no, I'm not doing that. And I say, well, those are the answers we got from you. So sometimes it's an eye-opener to some things that, because of routine and the fast speed that we go in swine production, we sometimes forget. So that's very important. The other part that we're using with PADRAP is we have a group of interns. We're working with Iowa State University, and this year we had 25 veterinary students from around the United States, and they all have different projects, and our main goal is that these students get exposed to the field since the first year of veterinary school. They have to have a project where they will be presenting, well, they have to submit an abstract, and hopefully they'll be selected to present their project at the student seminar at ASB. And all this is related, well, as you can see, we're a passionate group for PRRS, so all this is related to PRRS virus. And I'll show you some of the research we're doing. But part of the work also is to do the PADRAP surveys. There is a survival analysis program going around for 4 years, and it will be 5 years, to find out farms that were enrolled, and if they have broken with PRRS virus, what are the main reasons why they broke, and farms that have not broken, what are the main reasons why they have not broken. And that analysis is going to be really good. And so the students do this, and then with the mapping you can find out if zones that were orange, which is more or less biosecurity, have changed into green, which is better biosecurity. So that allows you to implement different strategies in a very organized way and change the situation, because as you can imagine, the most important risk factor is location of the farm, and that we cannot do anything about it. We cannot get our farm and move it somewhere else. Well, we can filtrate if we would like to, but we cannot move the farm, so you have to work around other things. So that's what we're also using, this different PADRAP. We also need to understand all the pig movements in the area, so we can understand how PRRS might be transmitted. I'm not saying that there's going to be any restrictions of movement or anything, not at all. It's just to understand if some routes could be used for certain type of pigs and others, and sometimes this cannot be, and this is something we have to learn to live with. So this is also something we do. Going from phase 1 to 3 can be pretty easy if everybody gets together, decides how are they going to share information, what are they going to do, what are the expectations of the project. And it's, as I said, that's not that very costly. When we get to phase 4, that is when we really need everybody to buy in, because this is the part where herd plans, regional plans, monitoring, maybe changes retrofitting in the farm, maybe changing the flow, maybe changing whatever pigs I produce, will have to be taken care. So this is a very important part where everybody has to decide. There are certain groups that each different farm has decided to do their own strategy, which is okay, and there are other groups that have decided to go and have just one same strategy done at the same time in order to try to reduce the impact as fast as possible. So this is a very important phase. And as I also said, there also has to be a regional project, not only the farm plan, but also the regional organization where you have a list of non-negotiables, certain things that you cannot change or move. They have to be respected. And then, of course, implement your different strategies. And then you go to phase 5. As you can imagine, phase 4 and phase 5 are the slowest, are the hardest, are where we have to make the most investment. And as I was saying, this is the phase where diagnostic plays a very, very important role. I don't mean to say that in the others it does not, because of course we need to understand the genetic diversity in the area, the prevalence, etc. But in this one, this is where tools, just as the oral fluids or FTA cards, pooling, all these different things are going to play a very important role, because we really need to monitor very closely and correctly if what we are doing in my farm and in my area is working. And this is one of the most important parts. And then, of course, that's when people sit down again and say, do I want to control? Do we stop here? Or do I want to eliminate? And I think that that is a decision that most everybody will have to take in some years from today. That's it. At the same time, we have to think, right now we have to change, break the paradigm of thinking only in my farms, in my things, and we have to think about regional. So you'll have to have some parallel actions, which are, as I said, continue the PADRAP, the funding, because we really need to know how much this costs. Yesterday I was asked the question, do you know how much it takes to go to phase 1, to phase 2, to phase 3, 4, and 5? Unfortunately, we don't have that. Actually, Canada is becoming very, very proactive on this control, area regional control, and they have a call to different institutions because they really want a very clear study of how much it will cost. Because it might be that you guys decide, well, you guys have a lot of truck washes, but there are certain areas in the United States where there are no truck washes. So it might ask you to put to establish a truck wash. So you need to put all these different things into the equation to find out how much it's going to cost, because our producers really need those numbers. The only way we're going to sell these programs if we can tell them their ROI is going to be high, and I think it is going to be very high. The other thing is that you need, all this is done by working groups, which means, you know, people get together. It can be led by a health clinic, a veterinary consulting clinic, by a university, and every example I tell you, there is one in the United States, by a university, by just veterinarians getting together, by whoever you want. So it's very different, but there has to be a working group that is in charge of establishing all this and making sure there is communication and that there is cooperation. That is one of the hardest parts, because all of us as human beings have different ideas, have different ways of getting to the same goal. So getting together and understanding that we all have to go to the same, we all want to go to the same goal, but we have to establish the rules. So for us, that has been key. And actually in our BI seminars, we have invited David Bracken, who is knowledgeable on working with working groups, on knowing what are the problems that come when we all human beings are in one same room and we all want to say that what we're saying is perfect and that's what we want everybody to do. So not in our workshops, we're not just talking about PRRS virus and diagnostics and sequencing, all of this. We're also talking about people, because we have seen that it is very important that the people component, the success of this project has a lot to do with the people component. I went back. This is the document I told you we are producing, and as I said, we cannot give you the whole version, but we can share the ideas and we can share with you most of the things. We would really like to see it published, so that's why it's not readily available, but we can share most of the thing. I would just like to finish with two things. This is, I would show you which are the projects that are going around in the United States, and this is the map. There are 3 other projects that are in the back burner, but they ask us not to include them yet in this map because they are still getting organized and they don't want at all to be mentioned. So there's other 3 projects. So you can see that we have Pennsylvania. Pennsylvania is the whole state, as I said, but Pennsylvania will also be working at different parts because of the way they are organized. There's a project in Northwest Indiana. This is Michigan. The first 2 projects that start in the United States are this Michigan and this West Central Illinois. In Illinois, there's 2 projects. As I mentioned, this is what we call the Bethany or the DeKalb project. Then the oldest project really that I said the first 2 projects funded by CAPS 2, but the oldest project is the Minnesota, and it's like the whole state. It started with Stevens County, but now it's it's divided by the 212, it's north of 212 highway. They have accomplished a lot of things. They are probably the group that right now could say that they will achieve elimination in the project, and they are thinking of moving now south. Of course, you can imagine that that will be more complicated because most of the pigs are produced in the southern part of our state. Then we have a project in Nebraska, in Colorado, and the whole state of North Dakota. This started as an initiative of pork producers. So those are the projects that are there. As I said, there's other three projects in the back burner, and there's also some initiatives of groups, of big groups in certain states, but they also asked us not to put them in the map. So those would be the projects that are, and that you would find the information on the swine cast, and we can share with you. Every single thing that we are doing and what we are supporting the industry is being documented, because we think that would be the only way that we can share further on with you why this thing is successful, why this other strategy is not working, etc. So what we are doing is tracking, first of all, the phases where the different projects are, and as you can see, it doesn't mean that you go from phase 1 to 2 to 3. A lot of the projects are doing a little bit of phase 1, a little bit of phase 2, a little bit of phase 3, but you can see those are the projects in the eastern. And as you can see, the project that is the most advanced project is the North Illinois, which is the DeKalb. And this is a really nice example of when people get together. They're the last project that started. They just started their initiative, and we were invited to participate in December. And as of right now, they are already in phase 4. They have established their herd plans, and they depopulated a stud that was PRRS positive. They depopulated the GDU that provided replacement animals to all the farms there. They filtrated all these things. We have several projects that we would like to do as research projects that we submitted to National Pork Board. So this is a very, very proactive and very aggressive, in the good sense of the word, group. So you can see some of the other projects are a little bit, sometimes are stopped, and each project has its own explanation of why it's not moving as fast as everybody would like it to be. Then these are the other, this is the, I'm sorry, I put the wrong, but okay, these are all the projects. So these are the ones I just showed you, and this would be the projects that are going on in the western United States. And so, as I said, the Minnesota and the Colorado projects are the two projects that are advancing at a faster speed. As we do all this, as we work, as we are invited by the industry to support all their efforts, we also want to generate as much research as we can. So as I told you, we have 25 summer interns, and they all have a specific project. But also, as our group, we also have many other initiatives. But I would just like to give you some examples of what we are doing. And this is the contamination risk associated to transport. We do believe that it is very important. So we have Peter Schneider, and what Peter is doing is he's going to all the truck washes where we are allowed to, and he is sampling before the wash starts. Then the trucks are going to be washed, before they're washed, after they're washed, and then the truck wash again when it's supposed to be washed and cleaned and disinfected. And this is a project that hopefully will be accepted to be presented at ASB. Information that's coming out is very, very interesting. You could also say scary, but we will share. If you are interested in this, we will go to your truck wash, and we will show you, we discuss the protocol with you. We will discuss your own information. You will have access to every single thing. And then, of course, the general information will be coded. Only you will know which is your truck wash, and we will know what are all the truck washes. But I think it will be a very, very important piece of information for the future control and elimination of PRRS virus. The other thing, Bob Morrison, right now, one of his students, Daniel Linares and Monse Torre Morel, got a grant to understand all the different strategies, as it says there, whole herd exposure programs, and how long does it take for those systems to go negative depending on the strategy. What I mean by strategy is either live virus, if it's MLB, if it's herd closure, you know, every single thing that's going on, the strategy you decide to implement, how long is it taking for that system to stabilize and go through a negative status, but also how much is it costing to the system, each one of these strategies. There is a website where you can register. There's also a clear explanation of the whole protocol. So if you want to be involved in that, the more farms we have, the more information we have, the best information we can supply to the swine industry. The other project that we are leading also in Pennsylvania is assessing genetic diversity. I had the chance to do a project with Dr. Murtek in Sonora, and we have taken that same model, and we would like to assess the whole genetic diversity in the United States, understand what this genetic diversity is. And we started in Pennsylvania because one of the summer students I'm in charge of, his professor had a database from 5 years ago. That was a project that was funded by, I think, USDA. So now we will be able to compare the difference in time of this genetic diversity and does it have any significance, etc. And so that's another project that we're doing. We would like to enroll in the future different projects in different states, but we're just starting with this program. And again, hopefully we'll get good information and it will be presented at ASB. And this is the last initiative we have, which is amazing. And if you guys would like to go to this website, the bioportal, this is U of Davis, California. And what they have is this bioportal where they follow different diseases such as foot and mouth disease, etc. And they not follow it in time, but they follow it also, it's tempospatial, the way they do it. And it's an amazing tool. We were just fascinated with what they can do, because they can put the different isolates, say, of PRRS virus, and just in time how they've been changing, but also in the places. So we talked to these people, we had this initiative, and last Friday what we had is we sent them a database that was provided to us, which is completely blinded up to the point that the farms are in Alaska. Okay, so there's no farms in Alaska, so nobody will know, and it is completely blinded, but it is so interesting. And we just got the first taste, and we will not be able to show it to you because the group that provided us the data has not seen the results of this, and they should be the first ones to see it. So it is there, and we will be able to work with that. Talking with our group, we will be able to put weather, winds, mountains, everything in there. So if we have information, if you can upload all your information there and find out how PRRS is moving, and you can relate it to time, to wind, to everything, it will be an amazing tool. So this is just, you are the first audience to listen to this, and we just finished all the confidentiality agreements and all. So we're going to start working with this tool, and this is another tool that we as a group with BI will be able to provide to the swine industry.